So again, this is an orientation webinar for our online technical assistance platform. It's being launched today, and as you can see, these are the staff members who've helped put together this presentation that we're going to walk through this afternoon, and we're hoping that it will be very informative for all of NASTAD's members. So just to begin with a definition of what exactly OnTAP is, it is NASTAD's distance learning environment designed to facilitate and expand upon the organization's peer-to-peer technical assistance exchanges and resource sharing. So as many of you know, as our members, that we do a lot of meetings and we do a lot of trainings and we do a lot of peer-to-peer TA visits with all of our jurisdictions. And we wanted to create a way that would allow us to really carry forward what NASTAD is really good at to more members. Whenever we have a meeting or whenever we have a site visit with our jurisdictions, it's always very tight in terms of how many people can participate in those events. And so this distance learning platform is really going to give us the opportunity to involve more people in the technical assistance that NASTAD is providing and facilitating among its members. So as opposed to folks who are just able to be there presently, or in person I should say, OnTAP will allow a lot more people to participate virtually. We've selected Blackboard as the host for OnTAP, and the reason that we did this is detailed here on this slide. Many of you are probably familiar with Blackboard. We felt like that would be an advantage. Blackboard offers quite a bit of training and technical assistance in terms of its help desk, and it really was able to do a lot of the things that we wanted to do with our distance learning component. We considered some other services, but we settled on Blackboard because we felt like it was the uptake would be easy to use, that it would be somewhat knowledgeable both from the members and from the staff perspective, and we felt like with the additional help desk capabilities that Blackboard provides, that it would be good for us. So throughout this orientation webinar, I want to be sure that all members are really clear about some terminology that I might use, or some terminology that you might hear if you ever have the occasion to interface with Blackboard's help desk. So one thing that we want to be very clear about is the difference between Blackboard Learn and Blackboard Collaborate. So those are two different interfaces that NASTAD has purchased, and I'll explain both of them to you. So let's begin with Blackboard Learn. This is really the foundation of the service that we have purchased. And in Blackboard Learn, it allows NASTAD to build courses and to build content that members are able to walk through at their own pace. So in Blackboard Learn, you might see self-guided tutorials, you might see guidance documents, you might see best practice documents, and you might see courses that are divided into modules. And all of them will be presented in a way that members can decide for themselves how they want to go about those. Blackboard Collaborate is what Blackboard uses to describe really its video and conferencing component to Blackboard. So we will be able to have webinars, conference calls, message boards, instant messaging, all those types of features. And all those types of features are clustered in what they call Collaborate. So if you ever needed to contact the help desk at Blackboard for help, and they were to mention or reference Blackboard Learn versus Blackboard Collaborate, that is the difference. So the URL that we're going to be using for OnTAP is nastad.blackboard.com. And on this slide right here, you are looking at the login screen that will show up when you go to that URL. On the left-hand side of this screen, you can see just a brief introduction about what OnTAP is. And so when any health department staff member comes to this page, the first thing they'll see is what exactly OnTAP is. In the center part of the screen, you see where it says Login. All members will have their own unique username and password that will be generated by NASTAD and provided to them. The construction of these passwords and usernames are going to be the same for everyone. So the construction for usernames will be your first initial and your last name, and your password will be password until you change it. Everyone who uses OnTAP will have to log in and will have to enter their password. But once you've logged in, you can remain logged in, so that shouldn't become a repetitive process for you. Below the login box, you can see just a brief video that we're going to use to place the latest and greatest from our capacity building assistants and from the other teams here at NASTAD. Actually, this recording of this particular webinar is going to go in that box as our very first video that will be on the home page of the URL. And on the right-hand side of the screen, you can see just a feed of the NASTAD blog. So this is the screen that you'll see prior to logging in. Once you've logged in, you're going to see the same screen with a little bit more depth to it. And one of the things you're going to be asked to complete is the HPAT, the Health Professional Application for Training. Most of you are very familiar with the HPAT. As a CBER provider, we're required to collect this information for our trainings and our webinars. Once you've completed the HPAT once, you don't have to do it again, but we do have to have one on file for anyone who participates in OnTAP. There'll be a tab that says HPAT, and you'll have to complete that HPAT at least one time, and we will remind you if you haven't completed it. But again, once you've completed it once, you won't have to do that again. So this is what the dashboard looks like after you've logged in. So once you've entered your username and password, the screen will change and it will look like this. The left-hand side where it says OnTAP will remain the same. The video in the center will remain in the center column, but it will now be the first thing you see in the center column. And underneath the video, you'll see something that says My Announcements. So those announcements are for system-wide announcements on OnTAP. So anything that NASTAD wants to say about courses that are being offered, about community of practices that are being offered, that will all be in that announcement tab. So you'll be able to see all of the system-wide announcements right here in this area where I have the green arrow. So this is going to be system-wide, and I say system-wide because OnTAP is really going to be personalized to each individual's wishes. So people will be able to log into the courses and into the community practices that they want. But the announcement section will be system-wide. In the right-hand column, all the way to the right, you can see it says My Communities of Practice, My CBER, and again the NASTAD blog. So in the My Communities of Practice, the entire OnTAP is really structured and created around communities of practice, which we're going to talk about in depth during this webinar. The ones that members choose to sign up for will show up here. The My CBER is going to contain all of the courses that members have decided to sign up for. So courses are a part of communities of practice, and so again, depending on which ones the members have chosen to be a part of, those will end up in that box right there. What you're looking at here is the real-time engagement, or what's known as Blackboard Collaborate, as I mentioned earlier. And this is the component for webinars, for conference calls, etc. So if I go back just one screen, you can see here on the top line of the dashboard a bunch of tabs. You see a tab that says My OnTAP. You see a tab that says Resources. You see a tab that says System Admin because this screenshot was taken from the admin panel. And then you see a tab that says Genius, which is going to be renamed for the HPAT. Once NASTAD is ready to launch in the next couple of weeks, there'll be a tab up here called Collaborate. And when you click on it, it's going to take you to the next screen. And that'll be the screen for webinars, for conference calls, and this is what the template looks like once you click on that tab. So in this interface, it shows you a video of the person that will be leading this particular webinar, or a video of the webinar itself. And in the screenshot here, you can see that a gentleman by the name of Al Goebel was talking to us in the webinar that we did last week. You can see the participants listed here. You can see the chat function. It's similar to the ReadyTalk system where it's all aligned on the left-hand side. And then in the center will be just the content for that particular conference call or web-based training. So here's how we've decided to structure OnTAP. And this diagram here on the right-hand side is very instructive around how to make sense of a lot of the terms that I'm using on this webinar. So the first thing to realize is that modules, the green circle, are a part of courses. Courses, the blue circle, are a part of communities of practice. and communities of practice are what make up OnTAP. So you can see in the universe of OnTAP, really it's a collection of communities of practice, and we're going to invite members to join a community of practice. And once they get into that community of practice, there'll be courses and then modules for those courses. So as we move through this webinar, keep this particular diagram in mind because it will help you to understand how we've structured the distance learning platform and how all of the terms intersect. So since the communities of practice are really going to be how we invite people to be a part of OnTAP, we thought that we would do a deeper dive during the webinar about what the communities of practice are, and then my colleague Edwin and Amy are going to walk you through the community of practice that they're going to be facilitating as a part of our OnTAP. But first, I'm just going to give you just a little bit of a description around what this is. So to make sure that we're all on the same page, I wanted to define what a community of practice actually is. It's defined as a group of people who share a concern, a set of problems, or a passion about a topic, and who deepen their knowledge and expertise by interacting on an ongoing basis. So a community of practice could really be on any topic. But in public health, our communities of practice are obviously going to be about HIV, STDs, and viral hepatitis. So you can see some of the desired outcomes for the communities of practice that we're going to be creating on OnTAP. And these are the three most important things to keep in mind. We'd like our COPs to be a compendium for public health best practices. We'd like them to be a forum for the development, discussion, and sharing of technical assistance products on specific topics. And we'd like them to have increased utilization of innovative media and distance learning strategies. Again, NASTAD's SIVA project is all about modernizing HIV prevention. And a large part of why we're doing this particular type of thing is because we want health departments to be more modernized in the way that they're approaching their prevention programs and to utilize new media and to think about ways to share ideas be outside of an actual physical meeting. So right now we have two established communities of practice. There's going to be one on sustainability and innovation, and the second community of practice is going to be on data to care. So first on sustainability and innovation. Some of you may have been involved in our SIVA regional meetings earlier this year that were facilitated by Amy Killalay and Edwin Corbin Gutierrez. And these meetings were really about how we could move the needle forward in terms of prevention programs to make sure that these programs were sustainable and to make sure that they were being innovative. We had 4 of them around the country. We developed approximately 100 action items as a result of those meetings. And so the very first community of practice is going to be all about sustainability and innovation to really move some of the discussions that took place in the regional meetings further along. We're also going to create a community of practice on data to care. Some of you may be aware that NASTAD recently concluded a 4-part webinar series on data to care. We had 5 jurisdictions that served as facilitators on this webinar series. And this particular community of practice is going to be an opportunity for health departments to do a deeper dive on data to care. So we're going to be looking at implementation, we're going to be looking at data sharing agreements, and all of the aspects of data to care. In the pink and blue boxes, you can see we have some question marks there because we're piloting these first 2 communities of practice, and the goal really is to, in the months ahead, to create more communities of practice and to unveil those as OnTAP moves along. And so the way that this works is that we will invite health departments to join communities of practice that they have an interest in, and within these virtual classrooms, there'll be some in-depth learning, some sharing, and some networking around very specific public health practices. There is not an expectation that all NASTAD members will be a part of all communities of practice. In fact, we envision that we may have as many as 10 communities of practice, and that the average NASTAD member will probably only be involved in 2 to 3 of those. As we move through a detailed look at the sustainability and innovation COP, you'll see why that is. I wanted to pause here to see if there's any questions based on what I've covered thus far. If you have any questions, just press *7 and ask your question. So via the chat function, I have a question here that says, will there be any additional OnTAP training information available at the NASDAQ TA conference beginning on Wednesday? So the answer to that question is no. We are not planning to do training on OnTAP during the mega meeting that's taking place this week in DC. However, we can work specifically with jurisdictions that have questions and set up specific opportunities to work with them and their staff around questions that may arise from this particular webinar. Second question is, will OnTAP replace the Target Center? Also, any chance that some of the trainings can be approved as CEs or continuing education credits for anyone who is the professional license, such as a pharmacist or a pharmacy technician, etc.? That's a great question. First, about the Target Center, the answer is no. So this will not replace the Target Center. And actually, the Target Center is really more aligned with our work that we have through a cooperative agreement with HRSA, and we are developing a separate website with that particular project that is separate and apart from this particular project. Our SEBA activities are funded through the CDC DHAP, and our work with the Target Center is funded through HRSA. The second question about continuing education credits, the answer is perhaps. We haven't made any final decisions about the CEs, but I envision that for some communities of practice, for some courses, particularly for the ones that will be led by health department professionals, that is a possibility. So now I'm going to turn the webinar over to my colleagues Amy and Edwin. They're going to go through an example of their community of practice, which is on sustainability and innovation. Amy and Edwin, just press *7 to unmute yourself to be heard.
Thanks, Isaiah. Hi, everyone. This is Edwin. For the next few slides, we're going to do a brief overview of our work in health systems integration. Talk about and then show you a couple of courses and modules as examples of what we're going to be doing on OnTAP. Amy, do you want to lead us off?
Sure. Can you hear me?
Yes, Amy, we can.
Great. So hi, everyone. This is Amy Killalay. And so as Isaiah said, Edwin and I are going to tag team sort of walking through what a community of practice is going to look like in practice. And we really wanted to introduce the sustainability and innovation community of practice. And before I turn it over to Edwin to really go through the mechanics of how we intend to use this platform, we really wanted to introduce the basic principles of this community of practice. And really, the same principles that apply to the sustainability and innovation work apply to health systems integration sort of writ large. So we see on the slide you've got in front of you, the cornerstone of this community of practice is really bridging public health and health systems. And in the HIV community, our guidepost has been the care continuum. And you see a visual there. I'm sure everyone is very well familiar with the care continuum. And it's really been an important way to frame the conversation about how we are addressing the epidemic. And it's been an important way to measure success as well. In the health systems and public and private payer and insurance world, the guidepost and central theme has been what is known as the triple aim, and that triple aim involves improving population health, improving the patient experience, and doing all of that in ways that are cost effective. So these two frames are actually complementary, and I think one of the goals of this community of practice is really to spotlight the ways that health department programs are successfully bridging this gap between public health and health systems. So we've got several areas of focus, and this is certainly a set of topics that are complex with many moving pieces. But we think that there are four basic questions that sort of overlay how we're approaching the topic. The first is how are we making public and private insurance payers more accountable for providing public health services? So how are we really pushing the envelope in terms of the services that are covered? How are we making those same payers more accountable for not only just providing those services, but providing quality public health services? And how are we supporting public health programs and providers to coordinate with these broader systems and new payment structures? And then finally, how are we supporting health departments to engage providers to really remain both relevant and sustainable in this sort of changing world, and increased insurance coverage, increased attention to payment and delivery reform, So those are the areas of focus that are really we're gonna sort of use to guide how we structure the community of practice. So, and I'm sure many of you have seen this slide before. This is how we at NASDAQ are sort of thinking about the sort of two simultaneous paths that are in no way mutually exclusive, and that really are guiding us as we figure out resources and how to highlight best practices. And that's, number one, really figuring out how are we going to and how should we integrate services and providers into these broader healthcare systems, really again pushing the envelope in terms of public and private payer coverage. What does that look like? Where is the innovation happening in payment and delivery reform? How do we include HIV prevention services? And simultaneous with that, sort of hand in hand, is really the question of what does that mean for core public health infrastructure and services that are not covered by public and private insurance? How are we allocating resources in a way that really preserves that expertise in infrastructure? And really, the key is doing those two things in tandem and complementary to one another. So as Isaiah mentioned, we started with regional meetings. We had 4 of them this year. We had pilot meetings the year before. And that really was a way to begin the conversation about sustainability and innovation and how HIV prevention programs are navigating this new world and are really innovating in this new world. So as Isaiah mentioned, we diligently developed action steps. And part of what we're doing with this sustainability and innovation community of practice is making good on those action steps. We're using this as a platform for the steps that NASDAQ identified and that health departments identified as good technical assistance resources that NASDAQ can provide. And then we're really using it to provide a venue and a way for health departments to work together with peers and with external faculty and other resources to make good on health department identified action steps. So with that, I'm going to turn it over to Edwin to really walk us through what this looks like in practice.
Thanks, Amy. So as you mentioned, Isaiah, we identified over 100 action steps from the regional meetings. And we looked at the trends, the different areas of work, and really defined these 8 kind of buckets that you see on the left of your screen. And we wanted to use this community of practice to continue that conversation from the regional meetings. So Amy and I identified 4 courses for this initial offering, and we're going to continue to develop more as new areas of interest are kind of emerge out of the work that we're doing, and possibly the regional meetings next year. So going a little bit deeper into how it works, for each course, we listed a series of modules that are going to address the action steps from the regional meetings. We are going to ensure that we cover the foundation, but also have room for conversations to troubleshoot implementation challenges and share lessons learned. And the principles that we are interested in making sure we address through this framework is making sure that the material we cover is immediately useful to our participants, making sure that it's relevant to your work responsibilities and your team's day-to-day work, but also that the topics we discuss in the community of practice are just being aware that some of these topics are new to participants, but for other participants, they're like the bread and butter of their day-to-day work. So knowing that there's many different levels of expertise, but also that issues are going to vary from jurisdiction to jurisdiction across programmatic areas and areas of responsibility, we want to make sure that all participants feel welcomed and that they're able to maximize the time that they spend on the platform. So we're using a variety of teaching techniques to make sure that we're engaging. We want to draw from participants' experience and expertise and have as many opportunities as possible to share experiences with each other. So let's look at one example. As you can see, this is the diagram from that Isaiah presented earlier, and we're going to talk about course 3, and then within that we'll look at a couple of modules. So course 3 is Cross-Public Health Program Collaboration on Revenue Generation, and here we identified a series of topics that we're turning into modules from the action steps, and we divided them into the building blocks and then the advanced on the ground modules. In terms of the building blocks, we have an intro, an introduction, assessing provider capacity by provider type, then looking at the cost assessment tools and return on investment, how to frame the value of public health services, other revenue mechanisms, other models for contracting, including we'll look at value-based opportunities, and a special focus on confidentiality. And then for the on-the-ground sessions and modules, we'll look at different lessons learned, models across public health areas, purchasing consortiums. We heard about a successful example with the Immunizations Billables project in Illinois at that regional meeting that as one example of many that we'll share. And then Learning Collaboratives, New York, put together facilitated workshops for providers, and we'll be hearing about that and many other examples as well. Within each course, there's going to be a learning sequence and learning units. So for this one, which is the module on cost assessment and return on investment, we will have an introductory video and then multiple resources. As we put these together, we want to make sure that we are able to have teaching methods that can transfer information fast in a clear and concise manner. So we have some expert videos, short videos, and then we also have the introductory webinar that are going to be pre-recorded. We also want to make sure that we enable participants to make connections. So we put in place a couple of opportunities for the discussion board and informal check-ins that work as a group, the way a group breakout session would in a face-to-face meeting. We wanted to make sure that participants are able to share their experience and expertise with peers and their staffs. And so this is kind of the multiple. This slide shows the different ways in which we'll be learning through the platform. So we're going to walk you through a couple of screenshots. This is the homepage that Isaiah showed you, and here in the orange frame you can see where the communities of practice are going to be. You'll see it listed once you sign up, and you can click on that, and that'll take you to the course homepage. Here you'll see the goals for the course, the format, and on the top left-hand side, you'll see the menu where you can navigate through the different sections of the course and the different pages. If you scroll down from that same page, you'll see the introductory webinar, and that'll give you an introduction to the different topics covered. These are learning objectives, and we'll make sure that they're smart. We want to make sure that they're relevant and that they help you assess the topic and level of expertise, so that you are able to decide what pieces, whether it's relevant and useful to you, but also what pieces or what areas might be of a priority to you. Through the learning units kind of outline, you'll be able to do some of that. If you feel confident in this area, you might just want to look at some of the tools or jump to any of the areas that are of particular interest to you. But you can also follow the sequence for the entire module. And then this is a screenshot of the discussion board. We will post questions, and we'll invite participants to post questions. This first question is, what sources of information do CBOs need to be able to complete a cost assessment worksheet? So some of these will be very specific to the course materials, and others will be more based on the experiences of health department staff implementing these different tools and working in these areas. We want to make sure that our platform is experiential in format, making sure that we are producing interactive opportunities for staff. We'll be consulting with experts, as Amy mentioned, and we hope that it's an opportunity to problem solve together. Any questions?
Just press *7 if you have any questions for myself, Amy, or Edwin. So one of the questions we got via the chat was, will historical presentations be available in OnTAP as it goes live? The answer is yes over time. So moving forward, all of the presentations that are developed by our capacity building assistance team, or our CBA team, will be stored both on the NASDAQ website and on OnTAP. And over time, we will move some of the kind of latest and greatest from the NASDAQ website over to OnTAP. So initially, we won't have a whole lot of the historical presentations, but as we roll out OnTAP and as it gets more and more sophisticated, there will be more and more things, not only that we're currently working on, but that we've worked on previously. Any other questions at this point before we move to our last section of this webinar? So I wanted to close by talking about resources, because resources is a very important part of OnTAP, and really we have designed it in a way that health department staff members are able to share resources, to download resources, to be able to put resources up on OnTAP without having to go through the NASDAQ staff. And so that's actually a huge part of how this is going to be collaborative. And so we wanted to make sure that as a part of this orientation webinar that we walk through exactly what that looks like so that all members could really be understanding and really be clear about that. So on the screen now, I'm showing you another screenshot, obviously, and this is a screenshot of someone who's already logged in, and it shows you what the Resources tab looks like. So up here at the very top, you can see where it says My OnTAP, it says Resources. Again, you see some other tabs, System Admin and Genius, that are going to be renamed in the system that you're going to see. But these first two tabs will remain the same. The Resources tab will allow you to upload any resource you'd like, whether it's a guide, maybe it's a sample job description, maybe it's a PowerPoint presentation, any type of resource that you'd like to share with your peers. You can upload that directly to the Resources tab. You can also download resources here. You can download them and email them as an email, or you can send them within the OnTAP system to anyone else who has a username and password. There's one caveat to the Resources tab. So the Resources tab is universal, and it's across the entire OnTAP system. So remember, the way that folks will be invited to be a part of OnTAP is through a community of practice. And people get to decide for themselves which community of practice they'd like to be a part of and how involved they want to be. The Resources tab is not necessarily for resources that are tied to a community of practice. Rather, the Resources tab is for any resource. For example, let's suppose that NASDAQ decided to do a webinar on HIV testing among Black MSM. So that would be a very good resource to share with our members, but we're not going to have a community of practice on that topic. So it wouldn't be appropriate to place that in one of the COPs. That resource would go under the Resources tab because it would be applicable to anything within OnTAP. So that's an example of how those resources will be captured there. You'll be able to go in and search for any resource. It doesn't mean that you won't be able to find community of practice resources there. It just means that it's going to have all sorts of resources that are applicable to anyone who logs in, not necessarily because they signed up for a COP. So on this slide, it shows you some help desk and support options that are beyond the NASDAQ staff. So as we roll out OnTAP, we're going to be inviting people to use their username and password to log into the system, to sign up for communities of practice, to download resources, and to begin to really utilize the system and to understand it. And at any time, you can reach out to the NASDAQ staff for technical assistance and support. And we are ready to do this type of call or webinar with health departments that would like to have some one-on-one TA in that regard. However, as I mentioned at the top of the webinar, Blackboard has some really good resources and some really good help desks that you could also reach out to on your own. And so I've provided these links here. We will be sending out these slides. They will be available on the NASDAQ website, so you don't have to worry about writing these down. But I wanted to make sure that you knew how to find the self-help and resources, the technical support, and specifically the resources on Blackboard Learn, which is the foundation for OnTAP. And so those might answer some questions for you before reaching out to Blackboard proper. So here's the contact information for the key people on the NASDAQ staff that are going to be working with OnTAP. So if you have any questions, concerns, suggestions about how we can roll this out and make it even more responsive to your needs, I encourage you to reach out to myself or to Edwin at any time, and be on the lookout for a memo to yourself, to your staff, to your peers, promoting Blackboard or promoting OnTAP through Blackboard, I should say, and asking people to get involved with it. So before we go, I'm going to open it up one last time for any questions. If you have any questions or comments, press *7 to be heard. All right, I don't see any questions in the chat window, so I would like to thank you all for your participation and have a great day.
Isaiah?